Hello everyone, we will start our cardiology lecture with lead placement. Lead placement is important to know because to find out the type of MI we are dealing with, we should know the lead placement. If you know this, it would be easy. You don't have to memorize it. So if you look at this picture over here, this picture over here, you can see that we have V1, V1, V2, V3, V4, V5, V6. So we have six chest leads, all right, and we have three limb leads. Limb leads, you know that we attach some electrodes to our hands, right and left hands, and one over the left foot. By attaching these electrodes, we are creating three more leads that record electrical activity in the frontal plane. What is frontal plane? It is the electrical activity that happens in the vertical part, in the vertical direction. Okay, so and we have here lead 1, lead 2, lead 3. Okay, and we have three more leads. For those, we are not attaching any electrodes, but it is calculated from the limb leads. I will explain you that in a while. Okay, first we will deal about chest leads. As you can see here, chest we have V1 to V6. Among this, the V1 to V4, if you look at these leads, it's clear that this is exactly kept over the anterior part of the chest compared to V5 and V6, which is facing lateral side of the chest. Understood? So now if you look at this picture, this heart, okay, here, yeah, this good heart. So if you look at this heart here, where we have kept the V1 to V6 electrode, it is kept over here. Here is the V1, V2, V3, V4, and V5, and V6 on the lateral side of the chest. They were V1 to V2, V3, V4. These we have kept over the anterior surface of the chest. So these are called, these V1 to V6, sorry, the V1 to V4, these are called anterior chest leads. Anterior chest leads. Now, a question, which leads show elevation in anterior wall MI? It is V1 to V4. It's clear now. But if you specifically ask me which lead show, definitely AST elevation, then that is V3 and V4, because these leads, the V1 to V2, it also face the septum of the heart. So assume here we have a septum. Okay, here we have the septum. So you can, it's clear that this V1 and V2 is looking at the septum, so V1 to V2 is also, it is also septal lead. So V1 V2 is septal as well as anterior, while V3 and V4, it's purely anterior. You understand? Yes. Now it's clear. Where is V5 and V6? Yes, here. This V5 and V6 is facing the lateral side of the chest. So we expect this V5 and V6 to elevated in lateral lateral wall MI. Easy? Okay. Now let's move to limb leads. As I mentioned, the limb leads are formed by connecting some electrodes in the right hand, left hand, and left foot. Okay, so by collecting this we are creating a triangle, Intovian triangle, but we don't need those electrophysiological aspects. Just remember we are creating three leads. First lead is between right arm and left arm by create, and that lead is called lead 1. Second lead is by connecting the right hand electrode and left leg electrode. This is called lead 2 electrode. Lead 2. Okay, lead 2, limb lead 2. This is limb lead 1. This is limb lead 2. Okay, now we have limb leads 3 by connecting the left arm, left hand, and the left foot. This is lead 3. Now how to remember which one is lead 1, which one is 2, lead 2, which one is lead 3? To memorize this, you can remember, you can start numbering like this: 1, 2, 3. Numbering should be done in an anti-clockwise direction. So like this. So here is a lead 1, this would be lead 2, this would be lead 3. Anti-clockwise direction numbering. So we have three leads, three limb leads. Okay, now about direction. If you look, if you have a closer look at the lead 1, the direction of the lead is towards which direction? The direction of the lead is towards left side. This is towards left side. Why it's left side, and I'm not going to go into that because you can see here some charges and or this in fact influences the direction. Okay, this in fact influences the direction, we don't need that. Okay, so lead 1 direction is towards left side. Now lead 2 direction is towards which side? It's going towards left foot. It's going towards left. It's going towards left. This direction. And the other lead, that is the lead 3. This is the lead 3 direction is again towards the left foot, but it's going towards which direction? It's going towards right. It's going towards the right. All right, now let us keep this heart over this picture. Okay, this is the heart. All right, let's make it a little bit bigger. I'm sorry if it's taking some time. Okay, okay, now we have the yeah. Okay, I'm going to erase everything. Yes, now have a look at, I told you in which direction is the lead 1. Lead 1 is towards which direction? Yes, it's going towards left direction. So lead 1 like this is our heart, and lead 1 is going like this. Where lead 2 is going? Lead 2 is going towards left side. So this is lead 2. And we have lead 3 is going which direction? This is the lead 3 is going towards right direction. So this is lead 3. Do you understand? So lead 1 is which side? It's on the lateral side of the heart. It's on the lateral side of the heart. Where is lead 2? Lead 2 is actually its inferior side of the heart. Again, lead 3 is also facing inferior side of the heart. Now, if you are not getting a three-dimensional picture, I will show you a different picture so that you will understand where exactly is lead 1, 2, 3 is placed. Let's look at the picture. Okay, we have a picture here. First, let us erase this. Okay, now, now come here. Let me again. It might take a bit long. Please. Okay, we have the heart here. Now let me rotate this. All right. See. So now I will draw. See, this is what I taught you so far. Where is lead one? Lead one is in this direction. Sorry, lead 1 is in this direction, lead 2 is this direction, this is lead 3, this is lead 3, right? This is 2, this is 1. And I told you that lead 1 and lead 2 is inferior leads. Let me show you where exactly it's arising, it starts coming out. It's here. This is lead, this is lead 3, this is lead 2. Okay, now where is lead 1? I told you it's facing on the lateral side. So again I will just rotate it. Yeah, so this was the heart front, this is the side. Okay, now lead 1 is coming from here. Okay, so this is which side? This is lateral side. If you can recall, this is v1 to v4 and this is v5, this is v5 and v6. Okay, so here I told you v1, v2, v3, v4. Here we have a v5 on lateral side, again v6 on lateral side, and we have a lead 1 as well. So v5, v6 and the lead 1, this is on lateral side. Now is it clear? Yes. Now we have covered 6 chest leads, 3 limb leads, and I told you we do have 3 more leads, but for that we are not keeping any electrodes, we are calculating from the existing limb leads. So after having this 6 leads, sorry 9 leads, the scientists, they thought that why can't we create some more leads so that we get accurate picture of the electrical activity of the heart in all direction. So they come across, they thought that okay, we will calculate a lead, it's a mathematical calculation. We will hypothetically think of a lead that is arising, that is perpendicular to lead 2. So a lead that is perpendicular to lead 2 and a lead that is perpendicular to lead 3. Okay, and a lead that is perpendicular to, this was lead 1, lead 1 like this. So these are the leads. They don't have an electrode. These are calculated. Okay, this is the lead that is perpendicular to lead 3, and again perpendicular to lead 2 we have another lead, perpendicular to lead 1 we have another lead. Okay, so this lead that is perpendicular to lead 3 is called AVR. Why? It's going towards which side? It's going towards right side of the patient. And lead 2, perpendicular to lead 2, we have a lead that is going towards left side of the patient. So this is AV augmented lead. Okay, A stands for augmented. AVL augmented lead left. And perpendicular to lead 1 we have another lead. This is called as AVF, foot, augmented lead towards foot. So these are the three more leads. Okay, so we have discussed six chest leads. Sorry, yes, six chest leads, three limb leads, and three augmented leads. So we have covered all leads. Now about the direction of AVR, AVL, and AVF, where exactly it's facing. Just memorize this picture just for a few seconds. Where AVR is going, where AVL is going. Most importantly, where AVF is going. Let's start with AVF. Where AVF is going, it's going towards lower side. It's going down. So let's take a picture here. So where exactly AVF? I told you this is AVF, but where exactly? For that, again, I will show you a three-dimensional picture. Let me take this heart and I will rotate it just a bit. Okay. Now this is where exactly this AVF is starting. Can you see inferior side of the chest? This is inferior side, and we have, and look at this picture. We let's take AVR. AVR is going which direction? Towards right direction. Okay, and AVL is going towards which direction? It's going towards left side. Okay, so let's take AVL first. Okay, let's take the AVL. Now again, AVL is which direction? It's going towards left. Again, we will rotate this picture. This is how normal heart look like. Now left side, little bit. Yeah, this is the left side. Left side means this is which side? This is lateral side of the heart. This is the lateral side of the heart. So AVL will be here, going towards left side. Not like this. This is which lead? This is lead 1. This is a little bit inclined. It's not exactly horizontal. So we have AVL here. It's facing lateral side. And AVF is showing inferior side of the heart. And we have one more lead that is that is going towards right side. This is not that important for us in determining the type of MI, and AVL will be on the right side. Okay, it would be around here, somewhere here. Okay, somewhere here AVL. Okay, now go back to normal picture. Okay, so I summarized all these leads in a single picture here. Can you see here where V1 to V6 is, where is V5 and V6 on the lateral side, and lead 1 is also on the lateral side. Now AVL is also facing the lateral side, and inferior side, I told you that we have obviously we have AVF. Okay, and lead 2 and sorry, lead 3 and lead 2. So lead 2, lead 3, AVF, these are facing inferior side. So if I ask you, if lead 2 3 AVF is elevated, ST segment elevation, sorry, the whenever I talked elevation here in this lecture, it means ST segment elevation, which is a significant features, it's an important features of MI. So lead 2 AVF, lead 3, this, if it's ST segment elevation, if there is ST segment elevation, then it is inferior or MI. Now V5, V6 and lead 1 and AVL, if these the ST segment of these leads are elevated, these leads or any of those two leads, okay, that should be yeah, in proximity. If that shows ST segment elevation, then that is lateral MI. And if ST segment elevation of any of the V1 to V4, it is anterior or MI. ST segment elevation of V3 to V4, it's purely anterior, but V1 to V2 is purely septal, but V1 to V6 is, we can say, both anterior and septal, so we call it as anterior septal. So I hope these leads placements are clear for you. It is important for localization of the MI. Thank you very much, and in the next lecture we will talk about ECG waves and the related abnormality of each wave. If you take P wave, you know, main thing is AF, and we have here PR segment and PR interval. Don't worry, all of them we will discuss. I just want to sensitize you, like what we are going to do in the next lecture. And this PR interval is important for us in heart block. We have different types of heart block, by the way, and that is also an important question that is asked in the Plab 1 exam. And very most important among the cardiology ECG portion is QRS complex. Why? Wide QRS, high heart rate, high heart rate, point towards which one? VT. Don't worry, we will discuss this in detail. VT. Then we have a ST segment here, okay, and this is ST elevation, means we have MI, pericarditis, and some other conditions, but our main focus will be on MI localization. The basics for identification of the type of I have explained here in the lead placement. Then we have T wave abnormality, very important thing, that is hyperkalemia and other conditions like early change of myocardial infarction. So this will be the discussion of our next lecture, and thank you for watching this lecture. All right.